Desi Burnette, and I am a statewide coordinator with MILPA, the Movement of Immigrant Leaders in Pennsylvania, and I'm a rights promoter for the Delaware County Committee of MILPA. MILPA is a statewide network of families who fight for the human rights of every Pennsylvanian, regardless of immigration status. Our network is over 2,000 supporters strong, with organized committees in Dauphin, Franklin, Lancaster, Delaware, and Philadelphia counties. We lead the Driving Pennsylvania Forward Coalition, a coalition of organizations fighting for the right to a driver's license regardless of immigration status. And we are part of the Pennsylvania Poor People's Campaign, together with Put People First, a national call for moral revival. I'm the proud granddaughter of immigrants, my great-grandparents from Mexico and my grandfather from Yemen. And I am one of the growing number of Americans who have struggled to meet my family's basic needs in the richest country in the world. We are here today to declare that health care is a human right, to call on our state to pass legislation for driver's licenses for all Pennsylvanians regardless of immigration status, and legislation that would create a health care advocate in our state to look out for the many millions of families struggling to access health care. I want to share a few testimonies of our members who could not be here with us today. 1, my name is Blanca. I live in Philadelphia, Pennsylvania. I am a mother of 3 children. We are from Mexico, and I want to share with you my experience. In February of this year, I was admitted to Delaware County Hospital emergency department for severe stomach pain and fever. On the 14th of February, I had emergency surgery, a colostomy. I can't get that right, sorry. Afterwards, I was told that I needed to come back for a follow-up surgery 3 months later to reconnect me. When I came back 3 months later, I was told by the hospital that they could not attend to me because I did not have medical insurance, and to return only when I had medical insurance. That day I felt very bad. I felt that it was unjust that a hospital could refuse medical service because of someone's status. I felt very discriminated against because I am an immigrant. We reached out to MILPA and to Put People First PA, who were able to help me get the surgery that was medically necessary for my life, and was able to have the surgery with the support and advocacy of these organizations. I want to see that one day every person will have access to health care, regardless of their immigration status, and for people to not have to experience the fear we experienced. 2, my name is Maria. I am a member of MILPA here in South Philadelphia. Why is it important to have access to health care? I have a health problem that is getting worse every day and over time. I have applied for emergency medical insurance many times, and each time I am denied. I pay taxes, and I believe this matters. It is unjust. Healthcare gives you the security of your health. And 3, my name is Luis. I am a member of MILPA in Upper Darby. Since the pandemic has started, our lives have been impacted greatly. My wife is undergoing cancer treatment, and her defenses are low. She is at risk for contracting COVID. I am a restaurant worker, and when businesses were closed, my work was cut to 1 or 2 days a week. I can't even provide the most basic necessities with this salary. We have accrued thousands in medical bills. If I had a driver's license, I would be able to do the most important and indispensable things to help my family, like getting to the store, to work, and most importantly, my wife to her doctor's appointments safely. Now I am beginning to educate myself more on my rights and on the need for us to be united in our communities regardless of our race, to struggle together every day. Since uniting with MILPA and the Poor People's Campaign, these struggles, I feel safer. I feel like I have backup, that we are not forgotten by the system. That is why I am here, to fight to find a solution for our needs. It is immoral that the people of our state cannot access basic needs in a time of abundance. During the last 6 months of this pandemic, those with the most have done the absolute least. Those with the most have grown their billions, and it has been us, the people of this state, who have looked out for one another, who have come together to make demands for our health and safety, for the future of our children. It has been us who have fed and housed each other. It has been us. No person in our state or planet needs to go without life-saving care, without preventative care, without mental health services, or without medication for themselves or their families. At today's Medicaid March, we call on the state of Pennsylvania to pass driver's licenses so that our families can access basic health services, and for the creation of a healthcare advocate to help the many in our state fight for the families who've been denied basic health services because we are poor, because of immigration status, or because of language barriers. A world where we are all able to live is possible, and it is up to us to birth it. Thank you. Forward together!